Good evening, everyone, and welcome to the Pediatric Telehealth visit. My name's Pam Villagomez, and I'm joined today by three of our HSS experts, Dr. Karen Onel, a pediatric rheumatologist, Dr. Melanie Prior, a primary care pediatrician, and Dr. Shevaun Doyle, one of our pediatric orthopedic surgeons. We hope that by the end of today or by the end of this webinar, you'll have a good understanding of how to use telehealth for your child's bone and joint health. And we'll address some of the common questions that we've seen come up, but also questions that you might submit using the Q&A feature at the very bottom. So I'd love for this to be a very casual conversation. And just from all of your perspectives, I'd love to understand which type of appointments you have found to work best via telehealth. And I'll start with you, Dr. Prior.
So I think from the general pediatric side, I can kind of speak to what we see in terms of just general visits. So some of the visits that work really well over telehealth just for general child health can be management of some other chronic conditions and medication management, which I think Dr. Onel will probably also get into, but visits that don't necessarily require an in-person office assessment with a physical exam and really require more of a conversation between the family and the provider. So that's with kids who have some more chronic issues, but in terms of just general well child visits also, different offices I know have different practices at this point, but we usually like kids to still come into the office for their general annual visit, the importance of having that kind of hands-on physical exam. And then certainly some of the behavioral and mental health issues are really great to address over telehealth. And these things can be done through a conversation and sometimes even just provides closer follow-up now that we have this opportunity to do video visits. Also, kind of nutrition and growth issues can be good things to address over telehealth.
Perfect. And you, Dr. Doyle?
I would say I have about 4 reasons that I love telehealth. Number 1 is going over imaging with patients. So I actually think they can see things better when we go to the screen and I can point things out with my cursor rather than them kind of looking around and my stepping aside from the screen to show them whatever pathology I'm looking for or injury. So I like it for that. Second thing I really like it for is post-op checks. If anyone has any concerns about a wound a little bit earlier, or just to check on the status of their motion, or to see if there's anything untoward that's concerning to whether or not to bring them back to look at anything from a post-operative perspective, it's really helpful. And I would also say, sort of as a sidecar for that, is checking range of motion. A lot of times when we see children for fractures and they've come out of their cast and they're otherwise well, but they're a bit stiff, and we just want to make sure, and they're all healed up on x-ray, and we just want to make sure that their bones, their joints are moving just fine, we'll do a range of motion check by telehealth. That's also excellent. And then the last thing that I think really helps in terms of visits is sometimes parents are concerned about the alignment of their toddler or the way they're walking. Right. And so to not have to bring the toddler in and have the toddler be in a environment that they're comfortable with, they don't get nervous about being in a cold examining room with this lady with the white coat who sometimes forgets to take it off. It really works nicely for that. So I would say those are the things that I have found very useful in my practice.
That's a great example with the toddler. And with reviewing the x-rays, assuming they've gone in to have that initial evaluation with you in person, and then you can review with them afterwards.
Right, x-rays or more, usually I get those when they're physically here, but if, let's say there's an MRI or a CAT scan that maybe has to be scheduled at another time, right, that's really helpful to then show the details of that.
Great, thank you. And how about you, Dr. Onel?
So I think an exam, going to see the doctor for something that probably the doctor is going to need to examine is really best in the office. And, if something is swollen or, a question about what something looks like, I've been very impressed, for instance, with the fact that I can't see rashes over the screen. People need to send photos of them because the resolution isn't that high. So I think anything that really requires, the laying on of hands, which is a lot of what we do, really should at least have an in-person visit, at some point. I think also we're pretty scared that we're going to miss something if we don't really get to examine somebody face to face. And so I think, there's that as well. The other thing about telemedicine that I think is problematic is a lot of our patients are teenagers, and I think it's hard for them sometimes to speak at home. They have no privacy. I certainly know that my children didn't want me in the room when they talked to their doctors. So I think, that can sometimes be difficult.
Right.
But the flip side is that, first of all, we had 3 months where we couldn't see anybody. And this really was wonderful in terms of being able to talk to people. And all of our teenagers had zero trouble figuring out how to do this on their iPhones. It was really amazing. And so it let us stay in contact, and it lets us continue to stay in contact with people who really live far away. Lots and lots of people drive hours to see us. And that's really just not feasible, the snow, et cetera. And the other thing is that I think has been really nice. If you have a young child and you go to the doctor's office, you really have no time to talk. And I've done a couple of sort of follow-up consultations while the toddler or young child is napping, where I feel like parents really have that good 45 minutes to sit and ask all those questions, which you just can't do in an exam room. So
Right.
That's been really wonderful in terms of just like having the option to really ask all your questions while you're looking at someone face to face. So I really appreciated that for a lot of very deep conversations about medicine choices and next steps and things like that, I think have been really wonderful.
Those are great points. Logistical questions that come to mind when you bring up 2 examples, Dr. Onel, is if a parent was to call your office to say, I want to just kind of recap what we had during that in-person visit, how would they schedule that? Is that like a consultation visit? Is that an examination visit? Just logistically speaking.
So truthfully, you call my office after a visit, I'm going to pick up the phone and answer any of your questions, right? So that hasn't changed. But there are times when you really need, like I said, 45 minutes to sit and look at people and talk about some really hard truths, which is not the same as like a 5-minute phone call. And at a time when, like I said, you want to schedule it, you want to pick a time, that the child is napping or at school or whatever, we can really ask the questions. There are some questions that parents do not want to ask in front of their children, just like there are some questions that children don't want to ask in front of their parents. And this gives an opportunity for people to really ask the hard questions. And so I think that's really been the thing that has really sort of shocked me, is you just get to have these really detailed conversations that I'm afraid we miss sometimes in the office.
Right.
And everybody knows the time is set aside, like they've cleared their schedule, I've cleared my schedule, and it's just a good opportunity to get everything out, which is one of the things I would say that's really good before a televisit. If you have questions that you're going to want to discuss, just write them down, because that way you don't get lost in the minute or nervous or whatnot. So people have an opportunity to say that I asked these questions, or I looked online, or a million different things. So it's an entirely different level of preparation to have a conversation.
Yeah, no, that's a valid point. Always have the notebook handy. I mentioned that with teenagers, sometimes they don't have the space. Has anything changed logistically speaking, that when you see a teenager in the office, typically a parent is there, I'm assuming, versus when it's a telehealth? Does the parent still need to be there?
Well, so the parent has to sign consent for the visit. But the difference actually is if they're in my office, I send the parent out to the waiting room. And I don't know where most people live, but my apartment is pretty small. And if I were speaking to somebody having a private conversation, everybody else in my apartment probably can hear that conversation too. And so I think if there's sometimes that kids want to ask questions, it might be hard. So they reach us in different ways. But I do think that interaction is different. But everything's got its pluses and minuses. I think having all of these options has just really, been extraordinary in that I've had people from all over the country who I've been able to meet. And so that's been really amazing.
Definitely. No, it's very advantageous. And are there specific visits that have you, or conditions or complaints that you have seen have not worked well at all, that you've attempted them via telehealth and then you end up just having them come in person? Dr. Doyle, you look like you have something at the tip of your tongue.
No, I would say, I think scoliosis has been a little bit hard. I mean, it's just as Dr. Onel said at the beginning, there are some things where we are hands-on, we are pediatric minded people, so we are hands-on, and that's a big part of the overall gestalt of our looking at kids. So I would just say scoliosis. I would say kind of a lot of things, but maybe looking at how somebody's walking is pretty good, but we still like to look at their spine and make sure there's nothing neurologic higher up, and not being able to do reflexes and trying to get the parents to do that. It's a bit hard, but I think, it's been a great adjunct for other things. But I would say for the physical exam, which we really depend on, it's hard because we need our hands.
And I think that, I would prefer to see revisits via telehealth, but it's not always possible. And we really want to be accessible to people. There aren't very many pediatric rheumatologists. People come from long distances. But I do think as long as people understand that at the end of the visit, there are times when I've said, I just need to see this in real life. Like, you just have to come in because I can't see the swollen finger, and everybody's been really amenable to that. I mean, it's just, that's, if you don't need to, you don't need to, but there are just times when you just need to see people.
Just say one other thing, Pam.
Yes.
Sometimes people are just, a lot are still very concerned about the pandemic. And so I would say that I'm always amenable to trying. And if I feel that I really need to see somebody, I'm going to be straightforward about that.
Right.
So I'm always willing to try telehealth, and sometimes I'm wrong and telehealth was adequate. But if not, as long as the parents know when they schedule that I might not be perfectly comfortable, and I think it's really a useful tool for that as well.
And I think actually your point is really well taken, because if I really feel like from the story and sort of what I'm seeing on the exam, like through the camera, is probably going to be fine. I'm much less likely though to say over the camera, I'm sure everything is fine without touching someone. Whereas if I did an exam and everything was totally normal, I might feel more comfortable saying, this is really nice, normal, and healthy, and don't be worried about it. Because I feel like for me as a doctor, because physical exam is so much a part of what we do, and the labs are not always helpful, I think that we can't always, it's easier for me to say when someone clearly has something wrong over a webinar than it is for me to say that something is not, something is not wrong.
Right. And has it been helpful at all in terms of triaging, like when you're able to tell someone they think they may have injured themselves, or there's something maybe a little bit acute, that you can direct them like, okay, you can manage it this way, or I need to see you in person? Does it have any service in that triage type of care?
Well, my patients will call me and say, I have a rash. Do you want me to come in? So there's sometimes like that, or the visit is really short, where somebody is just checking in and saying no fever since the last time you saw me. So I think for those periodic, I think those are really easy visits for the family if they can just essentially call in for a check-in and they don't have to come into the city and all of that. I think that that's great. So in that way, there's certainly triage.
Yeah, Pam, it just maybe a little related, but not quite the answer. Maybe there's just one other thing that I would say. Sometimes people really just want a second opinion about a surgery that's being proposed. And I have all of the ancillary information, radiographic studies, MRIs, lab work, whatever it is. And truly the person's very comfortable, but they just like to be, they've never heard of the procedure before, or they've never had a family member with the condition. So I would say that, look, I can't examine and touch your child, but based on how your child appears, how the radiographs and how the studies pan out, it makes sense to me that what the surgeon is proposing makes sense. I think that might be
right.
a place where it could be helpful.
Okay.
I think
How's
too,
that helpful?
From the general pediatric side, so especially throughout the winter and in the times of the pandemic, so kids who have relatively mild kind of respiratory symptoms or common cold complaints, a lot of those things, it can be really helpful to do a telemedicine visit to triage who actually needs to come into the office or who needs a hands-on physical exam. So for some of these kind of just common general pediatric problems, it definitely can be helpful triaging and minimizing exposure for everybody.
Right.
Perfect. And Dr. Prior, have you seen, or is there any role in telehealth for the pre-surgical visit? You know, if they need to connect with you prior to a pediatric surgery?
Yeah, so that's something that we've been doing pretty commonly also. And there definitely are different indications for when a telehealth pre-op visit is appropriate. Certainly some kids who are having more minor surgeries or kids who are already well known to us from previous surgeries, it can be a helpful way to do a pre-op visit. Certainly, like we've kind of been alluding to, there's some of these complaints that really do require a full physical and hands-on exam before some of these bigger orthopedic surgeries, but that's something we've been doing pretty commonly.
So it's more of a case-by-case basis as opposed to a standard procedure.
Exactly.
So in the cases that we've talked about where telehealth is appropriate, how could we best tell parents or guardians to prepare and so that they can have the most effective telehealth visit? You know, what can they expect and how should they set things up?
I think the one thing I would say is that sometimes the telehealth visits for like a check-in feel very casual, but you really can't examine people in a car or in a supermarket or Walmart or the stories of where people are when they call. It's a HIPAA issue, if nothing else. You don't want to hear other people hearing the medical issues. And so I think they really should be done from a place where you can be available to show a physical exam or, you know, express what a child is able to do or ask questions calmly, because it just feels very awkward to have conversations out in public that we would otherwise, you know, never do because we're very protective of people's private health information.
Very valid.
I would say for me, especially since I am going to be looking at a toddler walking or to see a complete body part, I just need to make sure that there's a little bit of a runway, like maybe the hall, and a mobile device. So maybe if they did the telehealth on an iPad or a laptop computer, it's a little bit easier for that.
I like the idea of a runway.
Yes, very perfect.
A runway.
That could be fun. And Dr. Prior?
And I was just going to say too, I think just coming prepared to the visit as you would to any in-office visit, having the child's medical history, medications, other surgeries that have been performed, just having that already. And sometimes that's even easier over a telehealth.
I will add one other thing, which I think is interesting, which is we can't prescribe medications in New York State to people who are under the age of 19 without a height and weight. And when people check in for televisits, often, I mean, you don't know child or how. And so if the one thing I would ask would be, do people know their children's height and weight, which sounds so silly, but I can't even prescribe, you know, ibuprofen without someone's height and weight. So just a simple thing like that is tremendously helpful.
It almost kind of dictates that any visit that might end up with medication should really be done in person, because otherwise, for someone that is teetering on that limit or age range, you know.
No, I mean, the truth of the matter is most of the time it's really fine, but literally we cannot do this. Like, it's just actually a block. So I'll go to prescribe, let's say something simple and like vitamin D, and you can't without a height and weight. And I want to be helpful and get everything done in a timely fashion so everyone gets what they need.
Right.
And we've had instances where, I know this is really silly and I don't need to go on about this, where we've actually had to call the pediatrician and like go through the chart and figure out. So, because we're trying to be respectful of people's time too. I want to get whatever they need, you know, as soon as I can get it for whoever needs it, so that everyone can just go on and have a happy, healthy life.
That's a valid point. I could tell you for my teenager, I probably could not tell you her height.
Exactly.
Maybe weight, but not height. And so, since they're not going in the office and getting the nice shorts that they might get when they're coming in for an in-person evaluation, should we tell them to wear a certain type of attire?
No skinny jeans, which apparently are out of fashion right now, apparently, for the people who are not, like my age. But apparently skinny jeans are out, but if they like skinny jeans or leggings, it's just really hard to see, knees and stuff like that.
And I think even for some of the patients, Dr. Doyle, probably that you would try to examine for scoliosis, like if the girls can be wearing a sports bra or something that's kind of an open back that they can be viewed.
Yeah, I've actually told them to remove their bra, ahead of time. So
Yeah.
knowing that I have to look at your naked back, so however you can do that. Yeah. And that's actually easier too, because they just turn around and they're in their own house used to it. So
Right. And practicing beforehand to figure out if you're coming to the doctor because you have a foot problem, how you're going to show your feet on the screen. I mean, it's really, really interesting how incredibly difficult that is. It definitely needs prior
maybe a
effort.
twister.
Having someone nearby to manage the device is very good, because the hand-eye coordination involved with getting the foot to the camera is actually difficult. I agree.
Yeah, the iPad's a good thing. Or, also lighting. You want to put it in your bright, if you have a brighter room with a little bit of space, it's probably optimal as well, for sure.
And besides a runway of sorts, a chair or a bed, maybe if they have to be examined for their foot.
Yeah, I would say a bed, because I sometimes have them go on their belly so I can check alignment behind too. Yeah.
I've seen a lot of people's bedrooms. I will say they're really sweet. A lot of the children have really very, very cozy, comfy looking beds with lovely stuffed animals. So I've also met a lot of dogs, which I think has been really fun to see the pets and the other siblings.
That's a plus. That's a super plus.
The little siblings who are popping their head in because they're jealous because they're not on screen. I've gotten to see, family members of patients I've known for years that I've never met before because they never come to the office.
A very good point. Has there anything you've been able to diagnose via telehealth that you've been surprised that you thought it probably wouldn't be feasible? Like if you were to say this a year ago or even over a year ago, like, oh, I'm never going to do that via telehealth, but you've surprisingly done it successfully.
I would have thought a year ago that this was actually impossible. That the ability to really suddenly do this, I mean, in all seriousness, how we decide to go forward with this, I think it has utility. And I think it's been really nice for a lot of people to be able to have the kind of conversations that one can have without coming down to the hospital is a wonderful thing. But I was reading a study the other day about people who got sort of lost during the pandemic, and people went off their medicines and people got sick, and we didn't have that. And I really think it's because we were able to stay in touch. And that was really wonderful, that people were able to just say, like, I'm stressed, or I can't get my medicines, or a million different things that we were able to get done because we got this done so quickly. So as much as I sort of would have said a year ago, I don't know what I would do with that, can't be done, etc., it was a godsend. I mean, really, and just sort of keeping in touch with everybody. So I think it was really very, very important. And I think it'll just continue to be important for, many of the same reasons.
How about you, Dr. Prior, Doyle?
I would say it's definitely going to be a part of my practice. I really do love going over scans with people. It's really helpful.
You saw my nephew.
Did I go over a scan with him?
No, you went over his little broken clavicle, my grandnephew.
Good.
And then I was going to say, you mentioned it earlier, Dr. Doyle, that you can review the scans or MRIs. Are there any other tests that can be done in advance and then be sent to you, whether it's, blood work, or I'm trying to think of what other pre-work could be done?
Yeah, I mean, I would just say with like outside imaging, it's nice to have that. It gets sent, it gets put into our system, and then I can load it when I do the telehealth. So that's really helpful because we do get a lot of second opinion consults. So that it really is helpful that way. And I would say I would defer to my colleagues, the real doctors there, with regard to blood work.
So I think that's a really interesting question. Certainly if something has been done, we would just take anything and everything. And we're really fortunate in New York now because a lot of the hospitals use the same system. So we're able to see some of that in the visit, but it is really helpful having it before. Dr. Doyle is especially right about the imaging and in general. Sometimes people will say to me, is there lab work you can order beforehand that then we can just have that to discuss at the meeting? And the only reason I don't like to do that is invariably during the visit, whether it's televisit or in person, there's something else I want to do. And a lot of our patients are little, and I just don't want to like draw their bloods today and then say 5 days later, oh, I really want such and such, because I just don't like to put the children through the procedure. So most of the time I would rather do it at the visit. I do think that that's where telehealth is really great, because then we can have a televisit when the labs come back to discuss. I think it's hard for people to come down into the city to discuss the lab results, which is why people want it beforehand. But now that we can do this, I think it really just makes that also that much easier for the follow-up. What did the labs look like? What does it mean?
Yeah, I think there's a lot of value on that face-to-face conversation with results. So sorry, Dr. Prior.
Oh yeah, I was just going to say, I definitely agree with everything Dr. Onel just said. And in terms of preparing patients for surgery, aside from some of the routine labs that we know kids will need, we also know that we need certain consults with subspecialists or other follow-up visits. And so it can also be helpful. We'll kind of direct families to have completed those before we then sit down with them. And that applies both to in-person and to telehealth visits, but then all of that can be reviewed at once in advance.
Great. And Dr. Doyle, have you noticed any difference between the number of in-person visits in the city versus those that you might see regionally in Westchester? Is it the same kind of?
No, I would say since the pandemic, my office hours are generally very full in Westchester. So for sure, Westchester has kind of exploded a little bit, and partly because I only go there once a week, but also I think as things are easing up a little bit, people are a little more comfortable coming. It's a bigger space in the city. And I would say that I'm using telehealth more as an adjunct than I was earlier, trying to do more exams, for sure.
And if we were to, we mentioned, the in-person visits and people's fear that might still remain with the pandemic. What can we say to those that are watching to make them feel a little bit more comfortable about coming?
I actually have an answer for that.
Yeah.
It's a really simple answer, because actually I've been in the hospital almost every day throughout, and I've never caught COVID. I now have been vaccinated, thank you, which is wonderful, but neither did any of my partners. And I think that sort of proves that within the absolute complicated framework of the fact that you never know. We had a patient who actually found out that she was COVID positive in the exam room during the visit. She got an email. It was a pre-surgical screening. And so it happens, but we're very good at wearing proper protective equipment. And so then we don't catch it, and we're not giving it to anybody else. So I think I would be really reassuring. HSS has done a spectacular job. I don't think transmission in the hospital is really an issue.
One thing also, at least that HSS is doing in terms of the in-person visits for children, they're limited to one parent or guardian accompanying a patient into an office visit. And so that does limit the amount of people that are there. And that being said, just going back to our conversations on telehealth, can be also a good opportunity when a visit's appropriate for telehealth for them both parents to be able to be
Yes.
involved. But we are limiting the number of visitors that are both in the hospital and for clinic visits.
So in terms of scheduling of patients, they're done spaced apart, or, I mean, is that a question your offices might get?
The practice management, the managers that kind of oversee our practices are in control of the appointments for that very reason.
We've been, as I like to type, practicing social distancing. No one has been sick at home, basically. And so, for instance, we don't do checkout in person anymore. We tell people when they're done that they should just walk out. And that way we've cut down on the number of people sitting in the waiting room. We've spaced out the patients that we don't see as many people at the same time. So we've tried our best to give people plenty of room to separate. And that goes for procedures as well. If you were to have an MRI, for instance, or any other procedure, I've been very impressed with the way that they have blocked off the waiting rooms and everything to really give people their own space.
Perfect. Well, thank you. I think we've covered a lot of important points to help the children, parents, guardians understand, how to manage telehealth best and when to come in person. So unless you have any parting words, I think we've really covered a lot of valuable information. Any parting words? No? Okay, wonderful.
Thank you.
So I want
I
to
guess
thank.
thanks for listening to us. Thanks for
Absolutely.
that.
Yes, definitely. I
We
want to
really like our job and we really like kids. So I think we get sad that we don't see them in person, but so if we can't see them in person, we're happy to see them on video because we just really like working with kids,
yes.
right?
And more eye contact, right? When you get to see them on the video, hopefully. But no, we do thank you for tuning in. And if you have any questions, you can always reach out to us in the education department at pped as in dog at hss.edu. And we look forward to seeing you at future programs, and feel free to visit our YouTube channel for this recording and also other valuable programs. So we thank you all and have a great night. Thank you for joining.
Great.
Thank you, ma'am.
Bye-bye.
Bye.